Labrīt, dāmas un kungi, esiet sveicināti Siguldā. Good morning, ladies and gentlemen. Welcome to Sigulda. I am happy and honored to see you all in here. Yes, it's not only the capital of autumn in Latvia, but all Europe. Yes, it's not my marketing joke. Some years ago, Sigulda was nominated as the best place in the world in autumn. Yes, and it was in the British newspaper, The Guardian. Yes, we are lucky to live in a place where nature, history and culture goes hand in hand with active citizens. That helps our region's growth in tourism, in business, and of course in healthcare. Sigulda has a potential to bring together tourists, to bring together opinion leaders and smartest minds who work to make all our life better. I hope you will enjoy your time in Sigulda. Actually, I know you will enjoy because Sigulda thrills, and in raining days too. Have a nice day.
Good morning, ladies and gentlemen. Welcome to Sigulda, and we are very glad to see you here in our center in radiosurgery courses, which will be dedicated to intracranial schwannomas, skull-based tumors, and genitourinary tract cancer. And on behalf of our association, we are very glad to see you here. And I think that you will get some useful and new information, and you will be able to use it in your clinical practice. Thank you.
Isn't that true? Education means that we can treat our patients better, we can be better informed, we can perform a better treatment technique. I'm actually the very first physicist to be president of the ISRS. And I look back at my career in conventional radiotherapy, and I remember when I started, the smallest fields that we would treat patients with was somewhere around a 10 by 10 centimeter field, so 100 millimeters by 100 millimeters. And that was considered small. That was considered really targeted on the tumor. And when we think about the way that we treat patients now, with radiosurgery, it's all about treating the target, treating the tumor and sparing the normal tissue around. And that means that we can increase our tumor control and we can decrease our complications. And I think part of what we'll be learning over these next 2 days will be not only the correct indications, the appropriate indications for radiosurgery, but also how we can perform radiosurgery better. And my talk this afternoon will be about better targeting of tumors with better imaging. So I'm really, really pleased to be here. I wanted to be here to support the group here. So let the day begin. Over to Mikhail.
It is my great pleasure to be here. I'm working currently in Tokyo. I'm living in Japan for 17 years, but I'm originally from St. Petersburg. We collaborate with a team from this radiosurgical center for years, and we know each other for a very long time. And I wish to congratulate them with a perfect organization of this event. And I think this is the first radiosurgical meeting, not only in Latvia, but in all Baltic states, so we can feel ourselves as pioneers. And I think it's very important, because here there are not only radiosurgeons, also radiation therapy, colleagues who are working in radiation therapy, and probably also some neurosurgeons. And I do hope that this course will be of benefit for our patients. As you can see from the program, after each session, we have generous time for discussion. And actually, this is the most important time. Please address any questions you wish. And we have to share our opinions, which probably not be, it may be contradictory opinions. Let's discuss. Let's find best solution because this is the main point of this educational course.